Hello,
Dr. Chang.
It's Dr. Chang. Yeah, okay. Okay, what brought you in today?
So many things are going on. So, since 10 years ago, I'm having the same problems. I'm having a lot of pain, lower pain.
Okay.
And I have to go to the restroom several times per day. And my stools are sort of loose.
So you're saying you have diarrhea?
Yeah.
Okay.
Yeah, so I am so concerned about that.
So you're basically having some pain and some diarrhea. You have any other symptoms?
Oh, yes, I feel a lot inflamada as well. And
I don't know what that term means.
I mean, inflamada. So my stomach is big. So I feel like I am pregnant.
Okay, but you're not pregnant though, right?
No.
Okay.
I am not pregnant. I know that I am not pregnant. It's the problem. I feel, my stomach is so big and...
So it's distended, but do you think you have inflammation? Is that what you're trying to say?
Yeah, I guess inflammation, I don't know that word, but anyway, I have to go so many times to the restroom, and I had 3 big accidents.
Okay.
Big, bad ones, and I want to stop this.
So how long has this been going on?
Since 6 months ago, when I went to my home country, when I came back, all the symptoms get worse. So now the diarrheas are more liquid, and I feel more inflamada and pain.
Okay, so your symptoms got worse 6 months ago. Was that when you were in Mexico or when you were in the United States?
No, I was in the United States, but 6 months ago I went to my home country. And when I came back, and I started feeling worse and worse, the pain. So that's the reason, because I saw the curandero.
What is that? I don't know what that is.
Oh, in my neighborhood, we have a curandero, and he gave me some herbal medications.
Is he a doctor?
Not really. He's not really a doctor, but he's so good. We trust in him, and he gave me the herbal medication.
So he gave you herbs for these symptoms?
Yes, and helps a lot. And I felt so much, relief, and I felt great.
Well, you're still having symptoms, and really there's some studies that show that herbs can be helpful for these symptoms, but most of the studies are really not, they don't show good evidence for that. So I'm not really sure if that's really helping you with your symptoms.
Yeah, but the symptoms came back, and that's the reason, because I am here. And always I have to wear these kind of tops because my stomach always is so big. And
so do you have any other thoughts of why you got worse 6 months ago?
I guess because the food that I ate and the drinks that I drank. So, and I guess I brought some animals.
What does that mean?
Parasites.
Parasites?
Yeah. So
well,
I guess I
okay.
have that.
Well, you brought some of your blood tests and the stool tests with you that were done, and there's no evidence that you have a parasite or any infection. So I really don't think that's the cause of your symptoms.
So now I know what I have.
What do you mean?
I guess I have cancer, because if it's not that is, I'm afraid. I think I have cancer.
Okay. Well, you also had a study where they looked in your colon. It's called a colonoscopy. Okay, and it looks inside, and there was no cancer there.
No.
Yeah. So that was normal. So I also don't think that's the cause of it.
I'm so glad, but are you sure, 100% sure about that?
I'm positive about it. I saw the study, and that's not the cause. I mean, we have to treat your symptoms, and it may be due to a condition called irritable bowel syndrome. You've had it for a long time. You've had it for 10 years, but I don't think the herbs are the answer. But we have other medicines here that we could try. But I think what we should do is we should do a physical exam and talk again about this and decide what treatment.
Sí, por favor, señorita, help me. Yeah.
Okay.
Great. So, what did you all notice about this interaction, about the communication with this interaction, with kind of an eye on culture?
The senorita versus that one, Dr. Chang.
Okay, so she came in and she called her senorita, and the doctor took offense there. Yep. Interesting. And that was right. She rolled her eyes. And that was right at the beginning of the interaction, right? Kind of set the tone.
I was going to say, every time that Claudia said something in Spanish, she acted angry. What is that? What do you mean?
I don't know that word.
Great. So use of her native language kind of put the doctor in an uncomfortable position.
So there was no respect for the person who gave her herbs, or no respect that anything herbal would work at all.
Right.
Completely dismissed it.
Dismissed this idea of the curandero, which is like a local faith healer. Just there was clearly a lot of investment on part of the patient and no validation whatsoever, even mild, on the part of the doctor. Excellent.
She also didn't handle it with much empathy. The patient went right to, I have cancer. And the doctor just said, no, I've seen your colonoscopy, you're fine.
Right. So that's one of those situations, this has come up in earlier workshops, where the words were right, no, you don't have cancer, but the delivery was off. Great. Good, let's check in with our patient. Ms. Rojas, how did you feel about your interaction with Dr. Chang?
I felt that I saw that she has no compassion. She's not like my people. Like more sweet, more, she never touched my arm. And she said, hello. And she says, Dr. Chang. So, I try to, to be respectful, but I never thought that señorita is going to hurt her feelings. So, I treat people very well, and so she's not good.
She's not good, okay. Dr. Chang, how did you feel in your interaction with Ms. Rojas?
Well, I have to already survive in a man's world in gastroenterology, and I don't like to be called that. I don't like to not be referred to as a doctor. And I also felt that she was just kind of throwing all these things at me, and that from her country, and that wasn't necessarily valid in the United States. Sounds so terrible. I can't even say it.
Challenging to play the role of the oppressor, using big terms here.
Oh, and then when she got teary-eyed, I was like, oh no, Claudia, please, it's going to make me feel so bad. Good.
And just I'm going to step out for a moment too, and we are talking about cultural differences, and we're tuned into this cultural difference, but Dr. Chang brings up a very interesting, another cultural difference, which is the kind of gender imbalance in terms of physicians. So I just kind of want to note that too, that culture operates on different levels. And then she also actually noted something that we didn't point out, was that she seemed to be uncomfortable with the patient's emotions. So if maybe it's, again, not a stereotype, but maybe a pattern that Latinos can bring some emotion to the table, or if any particular Latino or anyone from any one culture brings some emotion to the table, the doctor needs to be able to handle that. And let's use that as a transition into, based on what we observed, what are suggestions to help Dr. Chang here be a better doctor so she doesn't have to feel as bad about herself?
I think just like an attitude of curiosity rather than dismissing. Oh, what is this foreign or whatever. Being curious about who's in front of you.
Move from discomfort to curiosity might help you in some of these situations. What else? And your cheat sheet is over there. Yeah, it's hard to read. Great. I think we've addressed most of this. And just seemed like you took offense, and you noted a cultural difference in your world. That, as a woman in gastroenterology, sometimes you like to make sure you get respect, but that seems to have a negative impact. So we might challenge you to breathe through that, maybe, if it happens again. Yeah.
Okay.
But it's hard to say. It's hard to say because culture is very much a part of us and does kind of impact our day-to-day. Great. So you've had some suggestions. So Dr. Chang, we're going to give you another crack at it.
Okay. Hello.
Hello, señorita.
Hello.
Nice
I'm
to
Dr.
meet-
Chang.
Ah, doctor.
Nice to meet you.
Nice to meet you.
Okay, how can I help you today?
Okay, I have a long story
Okay.
that started 10 years ago. And I'm having the same symptoms since 10 years ago. I'm feeling a lot of pain down here,
Okay.
aquí abajo. And I have to go to the restroom several times per day. And my stools are pretty loose.
I see.
So it is a lot.
So you're having some diarrhea with pain?
Yes, a lot diarrhea, and I have to go so many times per day to the restroom, and now I am trying to avoid to go out much because I don't feel fine,
What happens? What are you concerned about when you go out?
I had already 3 accidents, big ones,
see.
and made me feel so embarrassed.
Yeah.
So that's the reason, because I love to be at home. I can go to my restroom and all that stuff, especially when after I eat is when I have to go restroom. And so.
Okay, I can completely understand why having accents would be very difficult, and you want to avoid that situation.
Yeah,
now, you said that your symptoms are after eating. So, do you think there's certain foods, or do you think that's just related just to eating food?
I think I went 6 months ago to my home country, and after I came back, the pain and the symptoms get worse. So, and now my diarrheas are liquid. It's like a water. It's like a open, And I feel so much inflamada, and I feel pain. I have to go more frequently to the restroom. So,
okay, so you were talking and showing this kind of with your
yeah,
hands. So are
inflamada.
you okay? So
pretty inflamada.
So are you saying that it's distended, or that it looks
yeah,
bigger?
I guess so. But I feel like a pregnant. When you're expecting a baby, I feel like that.
Okay.
So and now look, I have to use all the time this kind of tops because my stomach is so big. So.
Right. So I definitely see that your symptoms have worsened, and we really need to evaluate that and try to help you. But do you have any thoughts about what it might be from, or why it's
I
worse?
guess I brought some animals from my home country. The bichos,
Like an infection?
Yeah, it's like amoebas.
Okay, so you're
Like
talking about parasites that you could potentially have brought from Mexico?
Yeah, and I guess I brought that because I ate a lot of typical food and I drank a lot of drinks in the streets. So
I can totally understand why you would think that. Luckily, you had some tests in Mexico that you brought with you, and it shows that you have no infection, so no parasites, so that's good news.
Okay.
Yeah. Do you have any other thoughts about why you think maybe your symptoms got worse 6 months ago?
So now I know what I have. I am afraid that I have cancer. Because if the results are fine, it's because I have cancer.
Why are you thinking that you might have that?
Because these symptoms that never stop. And since 10 years ago, I'm having the same thing. So, and the results are fine.
Does anyone in your family have cancer in the colon or the bowel?
No, nobody, but I'm afraid that I have cancer.
Well, fortunately, the way we can diagnose or we can detect if you have cancer in the colon is by a procedure called colonoscopy. And I know that having cancer would be a very upsetting idea. Fortunately, your study is completely normal, so there is actually no tumor or cancer.
Are you sure, doctor?
Yes, they actually did a very good study. I read the report, so that's not actually likely. That's not the case, in fact.
I'm so glad.
Yeah, so I want to reassure you.
Oh, so glad.
Yeah.
Oh, gracias, señorita. Gracias.
No problem. Okay, so what about treatment? Have you tried anything to
Yes,
improve?
I went to the curandero, that is in my neighborhood, so he's so good. He gave me some herbal medication, and we're so fantastic. So
is this a person that helps people with their symptoms and illnesses that you have? Okay.
Yes, and he's so good. We trust, everybody trusts in him. So we know him since years ago. He
All
was
right.
in my neighborhood, so.
And you mentioned that he gave you some herbs?
Yes, he gave me herbs and helped me a lot.
It helped you. Do you know what type of herbs they were?
Not really. He makes mixes. And
So you've probably been in the past?
We never asked what kind of herbs.
Okay.
But we saw a lot of herbs in his office.
Right.
Saw a lot of herbs. But I
Well,
don't know.
there's actually evidence that herbs can be helpful with symptoms like that you have. So it's very possible that helped your symptoms. Now, I do know that your symptoms are still continuing. That's why you're here. So we still need to try to get it a little bit better than so far. So we need to address that.
Please.
So what we'll do is we'll do a physical exam first, and then we'll get back together and discuss this further and try to decide how we can make your symptoms better. Is that all right?
Okay.
Okay.
Thank you. Thank you.
Let's give him a round of applause. So, what adjustments did Dr. Chang make this time to help improve this interaction? Ooh, it was perfect. Wonderful. Perfect why? Like, what adjustments did she make?
Body code, listening,
Good.
body language.
Good. So, simpatico. So, she definitely ramped up the empathy. And that was through body language, through validation. Wonderful. Along with empathy was a suggestion for curiosity. We've got our duo here. We'll call them curiosity and empathy if we see them throughout the day. How was she with the curiosity around the cultural differences? Did she make an improvement there?
Yes.
Great. What else? What other?
By accepting the introduction of senora.
It's actually a compliment because that's usually referred to people in the early 20s. So. Senorita.
That's correct.
Right. And whereas the initial reaction, being a woman in medicine, there might have been a gut reaction of taking offense, recognizing that it was a show of kindness, that there's a whole other perspective there, and rolling with that. Chris?
She validated the use of the herbs and how those can be helpful.
Right, absolutely. There's a whole other course of treatment coming, and the herbs probably won't even come up again, right? So just to validate that builds that rapport. I am respectful of who you are and some of the things that your culture values.
The other thing was the touching. When the patient reached out to touch her, she didn't pull away. She embraced it.
She rolled with it. She did.
And the first time she wouldn't even have done that, right? And this time she actually...
Yeah. And that's because the empathy and the curiosity and the rapport. And even if she was uncomfortable with it, she kind of rolled with it, right? She almost saw the deer in the headlights look, but hey, that's the way this woman does things, and I'm going to roll with that. Wonderful.
I've improved.
All right, let's give her a round of applause. She improved greatly.